Here's a week-by-week guide to what typically happens during a twin pregnancy. First trimester, weeks 1-12. Weeks 1-4. Conception. If 2 eggs are released and fertilized, fraternal twins develop. Identical twins result from a single fertilized egg splitting. Implantation. The fertilized eggs implant in the uterine lining. Weeks 5-8. Early development. The embryos begin to develop. The neural tubes close, and the heart starts beating. Major organs begin to form. Symptoms: extreme fatigue, morning sickness, breast tenderness, and increased urination. With twins, these symptoms can be more intense due to higher hormone levels. Ultrasound. By week 6 or 7, an ultrasound can confirm twin pregnancy by detecting 2 heartbeats. Weeks 9-12. Growth. The embryos develop into fetuses. By the end of this period, they have distinct human features. Symptoms. Continuing symptoms from earlier weeks. Some women may start to notice a slight increase in weight or a small bump. Second trimester, weeks 13-26. Weeks 13-16. Growth spurt. Fetuses grow rapidly, developing more defined features and starting to move. Symptoms: reduced morning sickness, but increased appetite and energy. Some women start to show a more noticeable bump. Ultrasound. Detailed ultrasound can often determine the sex of the babies. Weeks 17-20. Movement. You may start feeling the babies move, known as quickening. Symptoms: continued weight gain, possible backaches, and changes in skin and hair. Anatomy scan. A detailed anatomy scan checks the development of the babies. Weeks 21-24. Development. Babies' senses and features continue to develop. They can hear sounds and are practicing breathing movements. Symptoms: increased discomfort from the growing belly, leg cramps, and swelling in the feet. Monitoring. Regular monitoring for signs of preterm labor. Weeks 25-28. Viability. Babies are considered viable, meaning they have a chance of survival outside the womb. Symptoms: increased pressure and discomfort, possible Braxton Hicks contractions. Gestational diabetes test. Screening for gestational diabetes is common around this time. Third trimester, weeks 27-40. Weeks 29-32. Rapid growth. Babies continue to grow and put on weight. Their organs are maturing, and they are preparing for life outside the womb. Symptoms: significant discomfort, difficulty sleeping, and frequent urination. Monitoring. Close monitoring for signs of preterm labor and complications like preeclampsia. Weeks 33-36. Preparation for birth. Babies settle into a head-down position. Final growth spurts occur. Symptoms: heightened discomfort, shortness of breath, and possible colostrum leakage from the breasts. Weeks 37-40. Full term. Most twins are born around 37 weeks. The baby's lungs and brains continue to develop. Symptoms: intense Braxton Hicks contractions, nesting instincts, and the cervix begins to dilate. Thanks for joining us on this journey through twin pregnancy, week by week. We hope you found this video helpful and informative.